Hi, I'm Dr. Akshay Manohar with Centaur Medical Center in Orlando, Florida. There's been an unusually large number of infections of dengue in Puerto Rico since January of 2024. On March 25th, 2024, the Department of Health in Puerto Rico declared a state of emergency. So today, let's see what dengue is and what we can do to protect ourselves. So the dengue this year has not only involved Puerto Rico, but also the Caribbean and South America, with almost 1.8 million people affected. Dengue is an infection that's found in the tropical and subtropical regions of the world. In the United States, the infection is endemic in the Caribbean, where we find Puerto Rico and the U.S. Virgin Islands. In the Pacific, in American Samoa and the freely associated states such as the Federated States of Micronesia, the Republic of Marshall Islands, and the Republic of Palau. Endemic means a disease that's always present in that area. According to this report from the Pan American Health Organization, the Caribbean and North and South America are currently noticing a surge of dengue, affecting close to 1.9 million people who've been infected, as well as 422 deaths. There, if you look at the arrow, it points to the surge, which is much higher than it was last year. In the United States, the continental United States at least, dengue is not as common. It's seen usually in travelers who go to other regions, although there's been local spread noted in Hawaii, Florida, Texas, California, and Arizona in the past. So in Puerto Rico, on March 25th, 2024, the Department of Health declared dengue to be an epidemic because of the spike in the number of dengue infections. In the past 3 months, there had been at least 549 known infections, 29 severe cases, 341 hospitalizations. And to compare, in all of last year, there was only 1,293 infections. The Puerto Rico Health Department and the Vector Control Unit are working to investigate and control this infection. Most of the infections have been in and around San Juan. So what is dengue exactly? Well, it's a virus that's transmitted from the bite of an infected mosquito. There are four types of dengue found throughout the world. Dengue belongs to a family of viruses called flaviviruses, which includes viruses like Zika virus, yellow fever, Japanese encephalitis, St. Louis encephalitis, West Nile virus, and so on. So what happens to people with dengue? Well, they can have a mild infection causing fevers, nausea, and vomiting. They can have joint and bone pains that are common, and the illness lasts for a couple of days to a week. Most people recover after a week. One out of every four people who get dengue do get sick. So there are three phases of dengue, though not all people get the same typical symptoms. Not everyone suffers from the critical phase, thankfully. The first phase is called the febrile phase, or the fever phase. In this stage, people get high fevers of above 38.5 degrees Celsius or 101.3 degrees Fahrenheit. They can have pain in the eyes on moving the eyes, headaches, facial puffiness, redness of the eyes and throat, swollen lymph glands in the neck, under the arms, in the groin, and sometimes a rash seen mostly in children. Some people, especially children, can have bleeding of the gums and nose even at this stage. The severe form of dengue in the critical phase includes dengue hemorrhagic fever and dengue shock syndrome. They can overlap, and these conditions can be fatal. It affects about 1 out of every 20 people who get the infection, and especially affects children and pregnant women. Usually people have to have had dengue in the past to be at high risk like this. Why this happens is not fully understood, but what happens is that with the second infection, our body's response to the second infection results in severe damage to our own cells. Dengue hemorrhagic fever is especially dangerous and traumatic to go through. People bleed out of their noses and in their stool. In our blood, there are certain proteins important for creating clots to stop bleeding, such as when you have a cut or an injury. These proteins, along with platelets, which are the main cells involved in forming clots, are both destroyed. So when people die from this, they die from bleeding out because of the infection. In dengue shock syndrome, blood vessels such as in tiny capillaries get damaged as a result of the response in the second infection. This results in the leaking of fluid from within veins and capillaries into the surrounding flesh, causing swelling and puffiness, which can be seen around the eyes and in the feet because of the pooling of fluid in this area from gravity. If enough fluid leaks out, this will drop the blood pressure and can cause confusion, fainting, and even death. The Centers for Disease Control and Prevention, the CDC, recommends that people with belly pain and tenderness to touch, bleeding from the nose or gums, blood in the stool or vomit, vomiting at least 3 times in 24 hours, and those feeling tired, restless, or irritable seek immediate help from a healthcare provider. The combination of severe abdominal pain, restlessness, tiredness, and persistent vomiting at a time when the fever is getting better can be a sign of an impending severe illness. Severe dengue is a medical emergency, so please seek care immediately. So how will the doctors or healthcare providers find out if someone has dengue? They usually do a blood test, which confirms the diagnosis, and they also test for other viruses like chikungunya and Zika, which are found in the same areas. How is dengue treated? Well, there's no cure for dengue. People with fever sometimes take acetaminophen or paracetamol, known in the US under the brand name Tylenol. This medicine can be harmful to the liver in high doses, especially if dengue is also affecting the liver, so please use them sparingly. Many cough medicines also contain acetaminophen, so keep that in mind when taking this medicine. It's not recommended to take aspirin or ibuprofen for the fevers. Aspirin especially increases the risk of bleeding. It is a blood thinner. And please speak to your healthcare provider for the correct management of your specific situation. People with severe dengue need to be hospitalized, get fluids, and sometimes blood transfusions as well. So how can you protect yourself from dengue? Since dengue is transmitted mainly by mosquitoes, avoiding mosquitoes is the best way to protect yourself. Staying indoors with air conditioning helps because although air conditioning doesn't kill mosquitoes, mosquitoes don't like being in dry, cool air. And so staying here, especially during the day and at twilight, can help prevent bites. Clothing is very important to cover your skin. Wear long sleeves and long pants or trousers, even though it's hot. Mosquitoes like to find skin, though. So if there's any gap between your sock and your trousers, or between your shirt and your hairline, or like me, where you don't have any hair, mosquitoes like to bite open skin. Don't forget your hands. And spraying an effective mosquito repellent such as DEET on your clothes can protect you. You can use mosquito nets, and there's also mosquito nets that are sprayed with DEET. As far as your environment goes, mosquitoes like to breed in small pools of quiet, stagnant water found in potted plants, like in the plates of potted plants, in ponds, in tires. Rivers and streams and fountains are not ideal for them. They like flat, calm water. And spraying the environment with a mosquito repellent has not really shown to help because mosquitoes breed mostly inside people's houses. So what about vaccines? So well, there's two currently available vaccines. One's in the US, one is in other parts of the world. Both vaccines contain a live virus. It's not recommended for everyone, especially not for those with a poor immune system, such as due to cancers, AIDS, or taking certain medications to lower immunity, such as with transplants. Dengvaxia is approved by the US FDA. It's approved for use in children and adolescents ages 9 to 16 who have had a previous infection with dengue before, and it's confirmed with laboratory testing. Because vaccinating someone with this particular vaccine who's never had dengue before, it's not recommended because the second dengue infection is a lot more severe. Just like if somebody got dengue the first time and got dengue the second time, they'll have a severe response. Qdenga is not available in the United States. It's found in other countries. It involves 2 doses of the vaccine given 3 months apart. For people living in Brazil and Thailand, it's approved for ages 4 to 60, in Indonesia from 4 to 45, and above 4 years for people in the European Union. It was found to protect against severe infection by the 4 dengue serotypes, and the European Union considered that the benefits of the vaccine were actually better than the risks that the vaccine posed. This vaccine can be given to people who've never had the infection before. It's not yet available in countries like India. And whether it should be given to travelers going to endemic regions has not yet been determined. A single shot by itself is not thought to be protective as compared to both doses. There's a third vaccine called Butantan DV. It's a vaccine that's being studied currently and may involve only one injection. So where can you get reliable information about dengue? You can read it from these trusted sources from the CDC, the European Medicine Agencies, the World Health Organization, and Puerto Rico's Department of Health as well to learn about the ongoing crisis in Puerto Rico. So thank you for watching this video. If you'd like to hear about other topics, please put it in the comments below. Like, share, and subscribe with your friends. And see you next time. Bye.